My name is Kelly Patterson. I am the clinical nutrition educator here at OmegaQuant, and I'm going to be discussing our prenatal DHA test. All right, so starting off with a little bit about what is DHA. DHA is a long-chain polyunsaturated omega-3 fatty acid. So it's one of the main omega-3 fatty acids. And if you know about our omega-3 index, it's one of the two fatty acids that make up our omega-3 index. DHA and another omega-3 is EPA, are marine-derived fatty acids because fish and seafood are the primary natural dietary sources of DHA and EPA, of those omega-3s. DHA has been shown to have pretty significant effects on pregnancy outcomes, okay? So that is why we went on to develop a prenatal DHA test. So there are quite a few studies on showing that there are effects on both mom and baby during pregnancy and development regarding DHA. So for mom, there's a relationship between DHA levels and preterm birth. Again, gestation period, some evidence on postpartum depression, and DHA levels in early breast milk as well too, which makes sense because if mom is producing breast milk, there are a lot of those nutrients end up in the breast milk, whatever is in mom's diet. For baby, there's effect on preterm birth. Both mom and baby are affected by that. Brain development, our brains are made up of a significant amount of DHA, and we get that a lot from our mothers and from breast milk. Eye development, a lot of structures of the eye as well are made up of DHA. And there's good evidence on immune system development as well, both during gestation and during breastfeeding period. So DHA in pregnancy, what does it do? DHA plays a structure function role for both the brain and retina, okay? So when I talked about eye function, the retina is where DHA is primarily utilized and used for structure of the retina, and same for the brain. The DNA or brain structures are primarily built, the primary fatty acid in the brain is DHA. DHA also contributes to kind of a lower inflammatory state in general. Omega-3s in general are often associated with reduced inflammation, and DHA seems to be particularly anti-inflammatory in pregnancy. Because of this reduced inflammation and because of the strength of some of these structures, there seems to be a delayed initiation of labor in people who have higher DHA levels. And so you end up with a more fully developed infant. We want to keep those babies in for longer. The more they can develop, the better off they'll be when they come out. We want them to do as much development as they possibly can in mom before they are ready to come out into the world. So DHA seems to be important throughout all of pregnancy, but it seems to be most important during the third trimester. So once we get past, about 26 to 28 weeks, that's when DHA levels in mom become the most important and have the biggest effect on the time of birth. So the gestational age at which the baby is born. Okay, and this study showed preterm and term infants. This is from back in 2015, and what those levels were at different, stages of birth. And those born past 38 weeks, born to term, had those higher levels of DHA compared to those who were earlier preterm or late preterm. Okay. So blood and DHA levels are affected by input and output. So when we say input, this is, your diet. So that's our primary source of DHA in where we get DHA mainly from. There's also some endogenous production in our liver. So your liver produces a little bit of DHA. It can convert EPA and DHA back and forth. And so depending on which one you've got, more of. Sometimes you can end up converting one or the other, but your liver can produce some DHA as well. We also get some release of DHA from our adipose tissues. So we do have the ability to store DHA in our adipose tissues, and that can be released out, as needed sometimes. So then when that goes into our blood, and once we have that in our bloodstreams, it can be incorporated into mom's tissues and cell membranes. It can be incorporated into fetal growth and development, so into the baby's tissues. It can also be, again, because it's found in all sorts of connective tissue as well, too. It's kind of utilized in preparation for labor. It's also utilized in breast milk production. It's stored back into both mom's adipose tissue and baby's adipose tissue, and some of it gets oxidized. And this is, DHA's main function of reducing inflammation, so it can become oxidized. So when we are measuring DHA for this prenatal DHA test, we are looking at red blood cell DHA levels, okay? So we're looking at the tissue membrane. So all red blood cells have these fatty membranes in their cell membranes, these layers of fat that have omega-3s in them. They have a bunch of different types of fatty acids, and omega-3s are part of that, and DHA are a significant part of those omega-3s. So when we are measuring, when we do our tests, our dried blood spot tests, this is what we are measuring, is the amount of DHA, the percentage of DHA found in those red blood cell membranes. And the reason this is really cool, and the reason this is a really great test, is it's better than measuring just serum levels of DHA that's just floating around in the blood, because those can be affected by, did you just have a high fatty meal with a lot of omega-3s? Did you just take your supplement an hour ago or 2 hours ago, right, when it's digested and that amount hasn't been processed, hasn't been utilized yet? Whereas red blood cell DHA levels are a bit more stable, but they still do respond to changes in DHA intake over time. It takes, because of the life cycle of a red blood cell, which is about 3 months, it takes about 3 months for those levels to respond to increases in your DHA intakes. So you can't just eat one high DHA meal and fool this test, okay? Same thing goes for our omega-3 index. You can't just eat one high, omega-3 meal or take your supplement one time and affect the test. These are more stable over time. And again, they're not affected by that postprandial state, so you can't just eat something and have it affect. But it does respond to DHA changes over time. So if you're consistently consuming high levels of DHA over, a period of weeks and months, your red blood cell membrane levels will change. And so that's why this test is really, really cool. We get that kind of better picture over the long term. So for prenatal DHA levels, we would like our desirable level to be over 5%, which means 5% of the fatty acids found in those red blood cells are DHA. That's what we're looking for, okay? So if there are 4 DHA fatty acids out of 100 fatty acids found in that red blood cell, that's 5% is our prenatal DHA level. So this is a slightly higher level than we'd like for non-pregnant people, but because of the demands on a pregnant body, it's really, really important to have those prenatal, or to have those levels be a little bit higher in prenatal women. So dietary recommendations for DHA during pregnancy. So currently what is recommended is for women to consume at least 200 milligrams of DHA per day. So this is really important. And the reason we parsed out DHA is because I talked about, how important, and we're not just talking about total omega-3s during pregnancy. I talked about how important DHA specifically is during the process of pregnancy because of the brain and eye development of the fetus, right? And all of those preterm risks, gestational risks, seem to be associated just with DHA, not omega-3s in general. So it's really important when you're taking a supplement, especially, that you're looking at DHA content, not total omega-3s. It's very easy to just go to the store and grab an omega-3 supplement and not take a look at the content, but it's really, really important that you do. So we want at least 100 milligrams of DHA per day. And in order to get that, we would need to take 1 to 2 servings of low mercury fish per week. And I'll talk a little bit about some of those sources and how we get those and how to do that safely for pregnancy. But the low mercury part is important, but fish is definitely safe to eat during pregnancy. But what's the problem? The problem is that the recommended amount of DHA for pregnant moms is 200 to 300 milligrams daily, but most pregnant people and women of childbearing age are only getting about 60 milligrams daily. So we're not even halfway there. We're really not even a quarter of the way there to what we really need. And less than 1 in 10 pregnant women and women of childbearing age and nursing moms report taking a supplement. So for a lot of women, we are not seeing enough. We are not seeing enough DHA in their diets, and they're not taking a supplement either. It's really not one of the things that is heavily talked about when it comes to, hey, you need to take your prenatals. Hey, you need to make sure you're getting enough folic acid. We really should throw DHA in there and say, hey, we really need to make sure we're getting enough DHA. So if you want to know if you're getting enough, getting your levels checked is the best way to find that out. So this is a study from the American College of Gynecologists, or this is a study. This was a survey of prenatal DHA levels in the United States. And really there's lack of consensus from the American College of Gynecologists and other medical bodies about DHA. And this is why we don't see recommendations for DHA kind of across the board for pregnant women, because these medical groups are not putting those statements out. So this is again for the United States. It is seen that 55% of women have low prenatal DHA levels. 55% of women of childbearing age have low DHA levels. Only about 20% have that desirable level. About 25% are below 3%, so very, very low level. So it looks to be about 80% of women of childbearing age don't have enough DHA in their diets. And we care about women of childbearing age because we want to make sure that, if you were to get pregnant, that you have adequate amount of DHA on board. Now, DHA is most important during that 3rd trimester, but so you do have some time to get those levels up if you do find out you're pregnant and you weren't taking a supplement. However, if we can get those levels up before, you can get some health benefits as well too. And then, when you get pregnant, you have those high levels that you need. There's also a lot of mixed messages about the safety of fish during pregnancy. There are a lot of women who wrongly believe that you can't eat any fish whatsoever while you're pregnant because of the concern of mercury levels, and that is just not true. There is concern of mercury levels, but all we want to do is make sure that we're eating low mercury fish. And there are some fish that are kind of in that mid-level, maybe they might have a risk for mercury. We just want to eat those way less often, okay? We probably don't want to be eating tuna every single day, but you can have other types of fish like salmon, mackerel, sardines, those smaller fish that aren't the big predatory fish. They have very low levels of mercury, if any at all. And you can eat those fairly regularly while you're pregnant. There's a lot of mixed messages. And unfortunately, a lot of medical providers kind of err on the, because they don't get enough training, maybe, just don't err on the side of fish or err on the side of safety, that we're just not going to eat that. And a lot of women, again, want to be as safe as possible. So they think, we don't want to have that. And that's just not true. And again, prematurity is the leading cause of neonatal death in the United States. The rate is increasing, unfortunately. In recent years, we're seeing higher rates of premature births. And the prematurity rate in the US is about 10%. Certain groups, especially among African Americans, have pretty high rates of prematurity. And this is, again, babies born before 38 weeks. So again, African Americans have a rate of prematurity of about 13%. That's a lot of babies born too early. So anything we can do to potentially reduce that risk. This may not be a silver bullet, but it's just one of the things that you can do prior to being pregnant, during pregnancy. And again, it has benefits during breastfeeding as well too. It's really, really got a lot of benefits across the board. And we recommend, getting those levels checked, making sure we get adequate amounts of DHA in our diet. Okay, so this is across the board. What we see rates of preterm birth, or these are countries and their rates of preterm birth, where they fall on the desirable scale for those DHA levels. So we see here the USA, we're not doing so great. We have a 9.9% rate of preterm birth, and our levels are somewhere here in the 4% range. For African American women in the United States, that 13% rate of preterm birth, which is just so unfortunate, closer to that 4% level. When we see a country like Spain, they're just a little bit better than us on that, the prenatal DHA level. They're doing a little bit better on their preterm birth level at about 7.6%. Then we get over to these countries that eat a ton of fish, right? Japan, Norway, Ecuador, Finland. These are countries that have strong cultures of eating a lot of fish. So Japan, they eat a ton of fish, and their preterm birth level rate is at 5.9%. Finland, again, a lot of these Scandinavian countries eat a lot of fish, and they have strong fishing cultures, and they have lower rates of preterm birth, and their prenatal DHA levels are up here in the 6, 7, 8% range, which is just really, really high. So that correlation seems to be pretty strong between that preterm birth and DHA, prenatal DHA levels. Okay. So this was a really, really interesting meta-analysis of 70 randomized controlled trials, including almost 20,000 women that compared studies that gave omega-3 supplements or placebo pills to pregnant women, and they really assessed outcomes, the biggest outcome being that preterm birth. And this was a quote from the end of that study: "A universal strategy of supplementation may be reasonable, although ideally with more knowledge, this would be targeted to the women who would benefit most." This Cochrane review in 2018 determined that a universal strategy of supplementation can be reasonable for pregnant women, and especially or women who are considering getting pregnant, because there does seem to be such a strong relationship between prenatal DHA levels and those birth outcomes that we care the most about. Wanting those babies to stay in longer so they can become stronger and healthier. So there's just a really, really strong correlation there. And again, that's not even considering the benefits to baby once baby is born. There are also some other relationships. There seems to be a reduced risk of asthma in children from moms who had a good DHA level during pregnancy. So studies showed in Danish women that those who were supplemented with fish oil, their children were much less likely to have asthma later on. And this was when this was a supplement, again, not just diet. So supplements can be effective as well too. So this is our prenatal DHA test. This is what your report would look like if you were to get our test. This particular person, their level was low. We want to be above that 5% range. And it's really difficult to get, too high. It's almost impossible to have this be too high because of the way red blood cells cycle every few months. It's very, very challenging to have this be too high. It's almost impossible. So our desirable range is greater than 5%. So just a little joke here. Pregnancy is tough. So when we talk a little bit about what you can eat in your diet while you are pregnant, it sometimes feels like this when you are having a baby, that you get this list of foods that is so long, the things you are supposed to avoid during pregnancy. It can seem crazy daunting. So you can do this through supplements and through foods. It is safe to eat fish and seafood while pregnant. We want to make sure it is well cooked. We're not getting it, gas station sushi is probably not the way to go here, but salmon, Pacific mackerel, mussels, clams, scallops, all of those are low mercury, high DHA fish. All things that are safe to eat. They also contain a lot of vitamin B12. Some have vitamin D as well too. These are really, really nutrient dense fish that are low in mercury and are safe to eat during pregnancy. So it is absolutely safe to be eating fish during pregnancy. We want to avoid those higher mercury fish. So things like tuna, shark, any large predatory fish. It's really how the food chain works. So the small fish have a very small amount of mercury. The medium-sized fish eat those fish. And the big fish, things like sharks, they are eating the medium fish. And so they're eating a lot of them. So those mercury levels tend to increase with those large predatory fish. They're really, really high. That's where the mercury is all stored up, is in the big fish. So we want to avoid those during pregnancy and breastfeeding as well too. We just want to keep those out, is avoiding those. But you can eat the smaller fish. Those are perfectly safe and healthy. Talk to your doctor if you have any questions about those things and about any other things that you want to eat during pregnancy as well too. Choosing high quality supplements with adequate amounts of DHA. One thing to be careful of, especially if you're just grabbing one off the shelf, a lot of supplements are EPA heavy. They have really high amounts of EPA and a lot lower amounts of DHA. So just take a look at the back of that supplement. Take a look at the supplement facts label to make sure that you're getting a supplement that has a good amount of DHA. We also have a calculator at OmegaQuant.com to help you determine the appropriate dose for your supplement, okay? And as always, talk to your doctor. These tests are not medical tests. They are just for your information. They are just, help you guide lifestyle choices. So if you have any other questions or concerns, or you're just not sure about how you feel about taking these supplements, talk to your doctor. All right, so instructions for how to do this, how to take our tests. Our tests are super, super simple. Pregnancy can feel really invasive. You go to the doctor a ton of times, you're getting a lot of blood drawn. This is not one of those big blood draws. This is a super simple and easy test. This is what our instructions, you'll get these exact instructions in the packet when you get in the kit when you order one of our tests. So you take all your components out. The first thing you're going to do is register your kit at OmegaQuant.com. You're going to use the barcode on there to register your test kit. Fill out that information card on there. Then you're going to take your sample. It is a quick little prick on the side of your finger, couple of drops of blood onto our collection card. You stick that card back in the envelope and send it off to our labs. It is so super, super simple, so very, very easy. And you'll get your results in a couple of weeks. No big vial of blood that needs to be drawn. None of that. It's so simple, and you don't even have to leave your own house. No extra trip to the doctor. All right. So in order to order our test kits, a quick and easy, it's super simple. You go to OmegaQuant.com/shop, order an at-home test kit, register your test kit. Like I said, you need to use that barcode. Collect your sample, mail it in, and in about 2 weeks, you'll get your results sent back to you. We send them via email, but you can also access them through our web portal as well, too. So thank you so much. That is our prenatal DHA test.